Hey everyone, welcome back to the channel. Today, we're diving into a topic that might sound a little math-y at first, but don't worry, it's all about your teeth. We're talking about calculus. What it is, how it can damage the bone around your tooth roots, what a deep cleaning procedure looks like, and how to take care of your teeth afterward. Plus, I'll throw in some pro tips on flossing, follow-up cleanings, and even using a water pick. If you're ready to level up your dental knowledge, stick around, and don't forget to hit that like button and subscribe for more health tips. Let's get started. First up, what is calculus? In dentistry, calculus is another name for tartar, that hard, crusty stuff that builds up on your teeth when plaque isn't removed. Plaque is a sticky film of bacteria that forms on your teeth every day from food and saliva. If you don't brush or floss it away within about 24 to 48 hours, it hardens into calculus. There are two types: supragingival calculus, which forms above the gum line and you can sometimes see, it's often yellowish or brownish, and subgingival calculus, which hides below the gum line, closer to the tooth root. That subgingival stuff is the real troublemaker, and we'll get to why in just a sec. The key thing to know is that once calculus forms, you can't brush it off yourself. It takes a dental pro with special tools to remove it. Now, let's talk about why subgingival calculus is such a big deal. When it builds up below the gum line, it's like a little fortress for bacteria. Those bacteria release toxins that irritate your gums, leading to inflammation, think red, swollen, or bleeding gums. This is gingivitis at first, but if it's not stopped, it can turn into periodontitis, a more serious gum disease. Here's where the bone comes in. In periodontitis, the inflammation doesn't just stay in the gums. It starts breaking down the bone and connective tissue that hold your teeth in place. Subgingival calculus makes this worse because it's rough and porous, giving bacteria even more surface area to cling to and multiply. Over time, this can cause pockets to form between your gums and teeth, and the bone around the tooth root gets eaten away. If it goes too far, you could even lose teeth. Scary, right? But don't worry, there's a fix, and it's called a deep cleaning. So, what's a deep cleaning? The technical term is scaling and root planing asterisk, or SERP for short. It's a two-step process that goes way beyond a regular cleaning. Step 1 is scaling. The dentist or hygienist uses special tools, sometimes handheld, sometimes ultrasonic, to scrape off all that calculus and plaque from above and below the gum line. Those hidden subgingival deposits? Gone. Step 2 is root planing. This smooths out the tooth root surfaces so bacteria have a harder time sticking around and your gums can heal and reattach to the tooth. It's not exactly a spa day. It might take a couple of visits, and they'll numb you up with local anesthesia because it can be uncomfortable. But it's a game changer for stopping gum disease in its tracks and saving that bone around your teeth. Alright, you've had your deep cleaning, now what? Taking care of your teeth after SERP is super important to keep the healing going. For the first few days, your gums might be tender, so stick to soft foods like yogurt, mashed potatoes, or smoothies. Avoid anything spicy, crunchy, or super hot. Brush gently with a soft toothbrush. Your dentist might even recommend a special rinse like chlorhexidine to keep bacteria at bay. Here's a big one. Floss thoroughly. Flossing gets rid of food and plaque between teeth where your brush can't reach. Take your time, curve the floss around each tooth, and go gentle near the gums while they're healing. Your dentist might also suggest a water pick, a device that shoots a stream of water to clean between teeth and along the gum line. It's not a replacement for flossing, but it's a great add-on, especially if your gums are sensitive. Oh, and one more thing. Schedule a asterisk 3-month cleaning. After SERP, your gums need extra attention to make sure the disease doesn't creep back. Every 3 months, your dentist will check those pockets and give your teeth a professional clean to keep calculus from building up again. So, there you have it. Calculus isn't just a dental annoyance, it can seriously damage the bone around your tooth roots if it's not handled. A deep cleaning like scaling and root planing can stop the damage, and with good habits like thorough flossing, a water pick, and regular 3-month cleanings, you can keep your smile strong and healthy. What do you think? Have you ever had a deep cleaning, or are you a flossing pro? Drop a comment below and let me know. If you found this helpful, give it a thumbs up, share it with a friend, and subscribe so you don't miss our next video. Thanks for watching, and I'll see you in the next one. Keep smiling.